Hanun. Inna lillahi wa inna ilaihi raji'un.
Mata, 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 menene? Mata, 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 menene?
All right, good evening, everyone. It's already 8:38, so please kindly mute your mic. If your mic is unmuted, kindly mute it so you won't interrupt when the speaker is on already. Thank you so much. All right, so our speaker for tonight is Dr. Tosin. Yes, I hope I pronounced that well. So, sir, I don't know if you are ready for us. You can have the floor.
Thank you very much. Good evening, everyone.
Good evening, sir. You're welcome.
Yeah, I think you are the one to upload the. Am I right?
My co-coordinator will do that, sir.
Okay. Yeah, my name is Tosin Olamilekan Banjo. I'm a physiotherapist. I work with University of Uyo Teaching Hospital and also University of Uyo. This night I'll be discussing with us on rehabilitation team, being a leader and a member. I would like the slides to be shared, so uploaded so we can carry on. Thank you.
Okay, sir, please just give us some few minutes. She's currently on it.
All right, thank you. Do you think I can share from my end?
Sir, can we continue? Each and every one of us, we have the slide. The document has been sent to the group chat, so we can continue while she tries to upload in the course of time.
Okay.
Thanks, sir.
In rehabilitation is a set of interventions designed to optimize functioning and reduce disability. Um, Rehabilitation teams play a crucial role in healthcare by supporting patient recovery and improving quality of life. A team, like we have football teams, a team is just a group of people playing together, um, working together. Sorry, what's a rehabilitation team? Yes. It's just a group of people working together in order to achieve a goal. Is a distinguishable set of two or more people who interact dynamically, interdependently, and adaptively towards achievement of a patient or group of patients' maximum potential. Um, the aim is actually to help the patient achieve their potential. Next slide.
Mhm.
A team. Next slide.
Yeah.
There are different types of teams. We have interdisciplinary teams, in which case it could be all physiotherapists discussing a particular case, working on a case together. This happens when maybe you have a very funny case or a challenging case, and the HOD or the head of unit has assigned a number of people to work on that particular case together. Multidisciplinary team. This is when we say holistic care. You have different members of the team, different professionals working together on a particular client. This is what we have most of the time in teaching hospital. Different professionals are seeing the client, and this one is contributing their quota, the other is contributing their quota, and all that. Interdisciplinary team. In this case, um, different teams. This one works, this one takes over, this one does his part, and then the other one takes over. This one does his part, the other one takes over, like that. It's like what we have in sometimes in O&G. They take care of the child, of the mother. Once she has delivered, the pediatrics come and take on control and take care of the baby and all that. Everybody does what they are supposed to do, and it doesn't necessarily mean that they are working together. Everybody is doing their own parts, and they are focused on their own area. They don't really have to meet as a team to discuss. In multidisciplinary team, you all meet. Maybe there's a meeting scheduled when you meet and discuss that. Interdisciplinary team, you don't really have to meet. Between the parts. Then transdisciplinary team, this happens in probably care homes where um, each person is doing even beyond what their professional boundary is. Each person is just whoever is available is doing something. The patient is supposed to be wheeled. There's no cleaner around, or there's no support staff around. The nurse is there, she wants to wheel, or the doctor is there, he wants to wheel. Everybody's just working for the goal of the patient, irrespective of their profession. This happens in some care homes. This happens in some mission hospitals and all those places where they don't have the full complement, but everybody's just contributing to see that the aim is achieved. Next slide. Yes, composition of a rehabilitation team. We have the patient and the caregivers. These are the most important part of the team. The patient and the caregivers. These are the people. The patient is the primary person. The caregiver. Let me say, most of the time, informal caregivers are the main people who are affected by what is happening to the patient. And then we have all the professionals, the doctors, nurses, physiotherapists, occupational therapists, audiologists, social worker, and the rest of them. Next slide. Next. Can you hear me? Yes. The team lead. He provides vision, he coordinates the efforts, he ensures effective communication, he motivates team members, and he tries to resolve conflicts. Usually in a team, from time to time, there could be some conflicts. And he tried to ensure that the conflicts are resolved and everybody's eyes are focused on the goal. He tried to reduce, help to maintain a focus and reduce distractions. Next slide. Next slide. The team member, sorry, back, sorry. Team member um, ensures collaboration, make accountability for everything you do with the client. You probably will have to put it down. You have to be accountable. You have to explain. You have to have your reasons why you are doing it, and you are working within the ethics of your profession. You have to have respect for others. Hello, was someone saying something?
Not
All
at
right.
all, sir. Please mute
Okay.
your mics.
Okay. Okay. Uh, and then you have to adapt and
Sorry for the interruption, sir.
oh, no, no problem. Then you are contributing your own quota to the shared goal. And as the client gets better, as you achieve your goal, everybody's happy. Like they would normally say in the football team, it's not everybody that scores. One person scores and everybody's happy that that person is scoring because it's a team. One person scoring is the team scoring. Next slide. Communication in rehabilitation teams. Communication could be verbal and non-verbal. Sometimes you are looking at the body language of your colleague. Sometimes you are talking. Sometimes you don't want your clients to see what's going on. You are probably correcting something. This happens majorly when you are in the same profession and you are probably in the same department. A client is carrying out some trick movements, and then the senior person is noticing it and is giving the intern probably some clue that look, this person is not doing it right. Correct it. Stop this movement, and tell him to do it this way. And if the intern is smart, if the intern is smart, he will pick it and then correct the client. If he is not, he will just stay there and be wondering what is wrong with his boss, with his team lead. Then sometimes it's also documented in the multidisciplinary team. Usually, you find that every time you go, there's a case folder, and then you have to read what other people have written. Like I tell people, take your time, carefully read through what others have written. Even if you feel, oh, I know what they will write, no, but go through it, understand what they have written, take note of it before you touch the patient. Then team meetings. This is what is lacking in many places. Meeting as a team and discussing. This happens maybe in a unit, maybe neurology unit, pediatric unit, and the rest of it. But then when we have different professions coming together, this is more difficult because different people have different schedules and all that. But it's usually a pleasant thing when we can get different professions to come together, have team meetings, and discuss specific clients. Then professional specific approaches. This is where you are approaching just from the angle of your profession. You are specific about what you are doing. You are coming in just because of this, and you stay within your boundary. The other person comes just and then stay within his boundary. This is clear in teaching hospitals, but this might not be clear in mission hospitals. Sometimes in mission hospitals, boundaries overlap. You don't really know where are the boundaries because everybody is working together, and sometimes you are giving a helping hand in some other areas. So, but in teaching hospitals, you stay within your profession, and so these are different types of communication. You have to understand the environment in which you are in order to be able to follow the pattern of communication. Then we have the open, patient-centered, and goal-oriented communication. it's open, and it's on the goal, and it's not as if, oh, this is where you stop. You just communicate freely, coming in with different ideas that you feel might help the patient. You come up with different that you feel, okay, if the patient is not benefiting from this, he should be able to benefit from this. The patient is having this problem, why don't we try this? If this is not working, why don't we do this? And then we have the active two-way communication. You are communicating with the maybe the caregiver is also giving you a feedback, and also saying, well, with my knowledge of this person, this is what I know, and all that. Different styles of communication. Then next slide. Yes, effective teamwork enhance decision making and care quality. If we work effectively as a team, our decision making will be better, and the quality of our service, of our care, will be much better. The patient will actually enjoy it. There will be professional benefits. The No, the next slide, please. Okay, yes, thank you. There'll be professional benefits. That's our profession will have better, will be seen from a better light, and we enjoy better status within that health facility. Then system level advantages. What do I mean by system level advantages? For example, the return to hospital time, the period, the time, length of time that it takes a patient to come back to the hospital for the same reason will elongate. And then the patient feels better for a longer time. The hospital records better better service recognition by the public. And then when we work as a team, we pull our synergy together. And we are putting less effort individually, but we're achieving great together. There's also improved patient outcome, there's comprehensive care approach, and there's enhanced innovation. We can innovate, we can come up with things, and the patient actually gets the best eventually. What are the challenges in teamwork? Sometimes there's communication barrier. Sometimes it is as a result of people not knowing their roles, and then sometimes there's role confusion. This person doesn't really know where his boundary is, and so he can tend to jump into everything, while the other one who knows what he's supposed to do is not clearly stating that, oh, I think this belongs to this other person and this belongs to the other person, while the other person who seemed to be in between is not asking questions to say, oh, am I supposed to do this? Do I do this in addition to this and all that? Then there's also cultural differences. There are things that are acceptable in certain cultures that are not acceptable in some other cultures. Take, for instance, if you are in the north, for example, you will hardly see a man and a woman maybe hug as a way of a greeting. But if you come down south, for example, where I am, you see men and women maybe hug as a way of greeting. You see maybe younger ladies maybe greeting an elderly man. We expect that he pats them on the back as a way of greeting. That is cultural, but it's not accepted in some other places. And this could form a challenge if you're doing something that is against a particular person's culture. It destroys the team because the other person will not take it lightly, and you don't see it as anything. It's good that we study people's culture and know the environment we find ourselves. Then also a major challenge with teamwork is limited resource. If we don't have enough resources, if there's lack of funds, teamwork might not thrive. It might run into challenges, it might run into problems, and eventually we might find that we are not moving smoothly and things might nosedive. Next slide, please. Next slide. Yeah, strategies for success. Um, Number one, we must define clear roles. Even though we know our roles as professionals, sometimes if we have meetings, it's good that we tell what our roles are in terms of managing a particular client. Also, we foster open communication. Let's talk freely. Say this and say that, and all that and all that. Everybody discusses freely. Um, it provides continuous training. It's very important when we give continuous training. People's knowledge are updated. People are reminded of things they have forgotten, and so service is better. Then practice empathy. Permit me to say, as medical persons, if we cannot practice empathy, then we probably are in the wrong profession. Every medical person who provides health service is supposed to practice empathy regularly. You see a particular situation, you should be able to empathize. Let the client feel that you are connected to that situation. Let the client see that you feel that situation. That helps the client to actually trust you. That helps the client to actually connect with you. That helps the client to see that no, this person is ready to help me. If the client is not getting that feeling, sometimes it's difficult for the client to the client to surrender to you and accept your management. Then we must develop leadership skills. I want to say that we may not be the leader, you might be a member, but please, at some point, also in a team, in a reputation team, leadership roles sometimes might change because they probably are not, nobody is saying this is the particular leader or the other person is the leader, but depending on what you are doing for the client, the leader might change. If you are doing, if a stroke patient and he's still in the ICU and all that, somebody else might be the leader. By the time he is out and discharged and is doing rehabilitation, you might end up being the leader as a physiotherapist or as an occupational therapist and all that. So the role of a leader might change from time to time based on what actually you are doing for that client. Next slide. Yes, a case example is a rehabilitation team collaborates to help a stroke patient regain independence through coordinated therapy and support. Yes, you are collaborating. The physiotherapist is there, the speech therapist is there, and all that, and you are working together to ensure that this client gets the very best. The caregiver is also there, contributing their own quota, doing their best because you will not be the client throughout his home stay. So the caregiver, you are probably depending on the caregiver to help ensure the home programs and all that. Next slide, please. That should be the final slide. Yes, in conclusion, balancing leadership and membership roles in a rehabilitation team is essential for achieving optimal rehabilitation outcomes and client satisfaction. Thank you very much.
Thank you, sir.
Thank you very much. Did you hear me?
Uh, Thank you, sir. Yes, sir. Thank you, sir.
Hello.
Thank you
Yes,
so much,
sir.
sir.
Thank you so much.
Thank you,
All
sir.
right. I like. Okay, someone is raising up his hand already. I don't know if that's a question. So please, if you have questions, can you please signify by raising up your hand?
Yes, so it's a customer. Please, can I go
Okay.
ahead?
Oh yes, sir. You can go ahead.
Thank you very much, sir, for this wonderful presentation. My first question is with respect to the leader of the rehabilitation team. Even though towards the end of the presentation, I learned that you made mention that the leadership may change depending on the level of the rehabilitation. But I used to come across this physiatrist as the overall leader of the rehabilitation team. I don't know if that usually is considered the physiatrist. Then number two side with respect. Hello, or should I wait for you to respond before I ask my next question, sir?
Go ahead. Go ahead. I'm listening.
Then the next question is with respect to conflict resolution. I don't know if you can help shed more light on how the leader can resolve conflict in terms of in case where there is conflict in the rehabilitation. Then finally, with respect to interprofession, that is within the profession, sorry, or let me say intraprofession. Like, for example, our different units in the department, maybe neuro medicine, pediatrics, rehabilitation of a patient in that situation, can it still be considered as a team compared to that of multidisciplinary rehabilitation team, or must it be between or within different professionals? I don't know if my question is clear, sir. Thank you very much.
Yeah. Okay. Thank you very much. In the first place, the physiatrist, yes, in some cases they claim to be the head of the rehabilitation team, but I want you to know that in Nigeria we don't really have physiatrists like that. We don't have them in hospitals. Am I right? I don't know if you have them in your hospital.
Not at all, sir.
Yes, yes. So therefore, we don't really see them as the head of the team. The rehabilitation for us is our core, and so we own it. So we don't really look at them as they are head of the team. I've met physiatrists actually. I've met them. I've heard all those claims and all that. But for us here, we don't have them. So we own our team and we manage cases that we manage. The other thing is that when it comes to issues of conflict resolution, the leader usually helps them understand that whatever you are conflicting on, the conflict is not the focus. He helps them to make light of the issue of their conflict, settles it, and helps them to refocus. Because issues like that, you try to not put yourself into the main problem. You try to help everybody to downplay whatever is their problem, but focus on the goal. Let's remain focused on the goal and not be distracted. That is the approach that really helps. Because if you are not careful, if you are dragged into the main issue, you will be drifting from what you are actually heading to. I don't know if you get what I'm trying to say. Hello?
Yes, sir. Yes, I'm getting you, sir.
So that approach works a lot by helping the people, the parties concerned, understand that let's forget those differences and let's move towards the goal. This is where we are heading to. Can we just focus there and leave the smaller issues behind? That really helps us. Sorry, I don't know what's your third question.
With respect to unit, that's rehabilitation of the patient within the department.
Yes. That is intra-professional, and it also happens where we have different units in the department managing a particular patient. That is awesome. It's actually good. It helps the patient to benefit maximally. You have a child with Erb's palsy and also has a small fracture. The physio auto and the physio neuro are co-managing. That's beautiful. You have someone with spinal cord injury, and then you have the neuro medicine and neurosurgery physio managing that person. That's beautiful. You have someone who has stroke and has a mental problem. You have the mental health unit and the neuromedicine managing in the physiotherapy department. That's beautiful. They are all beautiful. They help the client get the very best. Does that help, my brother?
Yeah, exactly, sir. Sorry, please, can I take the last question again?
Okay.
Yes, with respect to challenges of the
Yes.
rehabilitation team, I
Yes.
saw that you made mention of cultural differences.
Yes.
So these cultural differences, I can't really pinpoint how it affects, how it becomes a challenge. Is it with respect to general teamwork, or is it with respect to rehabilitation team that it becomes a challenge? So I can't really get it clearly, sir.
Okay. Rehabilitation team. I have stated that even the client is a member of the rehabilitation team. Am I right? Do you
Exactly.
remember that? Yes.
Yes.
So if, for example, the client is a lady, and maybe the physiotherapist is a man, and he wants to attend to the lady, and she's not feeling comfortable. He needs to find out if she's comfortable. If she doesn't feel comfortable, maybe because of her environment, she doesn't want a man to touch her. He has to respect her. Do you understand?
Yes.
But in some
Thank
other climes in Nigeria, he might not even ask her if she's comfortable because he will just assume she's comfortable, and he knows there will be no. She understands that when she's in the hospital, she's going to be managed by anybody and all that. So the person, those are cultures that needs to be respected. I don't know if that helps.
Exactly, sir. Thank you very much, sir.
Thank you very much, my brother.
Okay, thank you so much, sir. I don't know if there's anyone that has a question. Any other question? Okay, so the absence of any other question. Okay, all right. Phyllis, let's hear you out. You can unmute your mic.
Hello, am I supposed to speak now?
Yes, you can go ahead, sir.
Okay, sorry, I'm by the roadside and I guess my mic might be disturbing the class, people around. But I want to speak on the issue of leadership on head teams. That word, semantics, is one of the words that is bringing problem for us in the healthcare system. I've worked on teams, and teams that I have worked on, I prefer to call the person, the leader, the so-called leader. And that when you change that word leadership to coordination, it makes life easier for everybody. And a leader thinks, okay, he's in charge. So when you talk of leadership, wherever you find a physician together with other people working in a team, by the Nigerian system, automatically they feel that the physician should be the leader of the team, even though his role may not be amenable or available at all the times on the team. So the aspect that the facilitator said, the leadership time to time, which is true according to the goals at that particular time. But if you have a coordinator, the coordinator remains no matter the stage you are in the rehabilitation of a patient. So I think if we start having rehabilitation teams, we may run into the same problem that we have generally in the hospitals when we talk about leadership of teams. So we should be thinking in terms of coordination rather than leadership. I run a Crawford clinic here, and we have is a multidisciplinary, and we have surgeons, we have everybody there. But I am the coordinator as a physiotherapist. Not necessarily because of a profession; it's because it was appointed. I'm appointed as a coordinator, so at any time I'm responsible to the clinic. But when it has to do with comes and is in charge at that particular time, we listen to what he's doing. If we're manipulating, the physiotherapist take charge. If we want to give shoes, the prosthetic take charge. So I think we should be thinking in terms of coordination rather than leadership to avoid the problems that we've been having in other places. Thank you.
All right. You know, they say leadership is influence. Um, whoever is owning the influence, whoever is influencing others at that time, can be assumed to be the leader. Well, coordinator, no problem. It's semantics. If they say this is the coordinator, it's okay. It's semantics. Um, whoever is actually wielding the influence at that time is assumed to be the leader, apart from the name. Thank you.
Okay, sir. Thank you so much. I think that's all we have for the questions tonight. Yeah, please can we appreciate our facilitator for tonight? Thank you so much, sir. We really appreciate it.
Thank you very much,
Thank,
everyone.
Yes.
I'm
thank you
grateful.
very much, sir.
Yeah, thank you so much.
Uh,
Thank you so
uh,
much.
Have a
thank
wonderful
you so
evening.
much, sir.
Thank you, everyone. I'm
Thank
grateful.
you. Have a wonderful evening.
So
Thank
snappy
you,
and direct to
sir.
the point.
Good night,
Thank you.
everyone.
Good
Yeah, good
night.
night, everyone.
All right, so there won't be quiz for tonight.
Thank you so much, sir.
Yes, there won't be quiz for tonight. No quiz for tonight. So can you all hear me?
Yes,
Yes, we
Yes,
hear
we
Yes,
can
you.
we
hear
can
you.
hear
okay.
you. Yes,
All
we can
right.
hear you.
So no quiz for tonight. So let's just call it a night. Good night, everyone.
Good
Good
night.
night.
Good night,
Thank
everyone.
you
Thanks.
so
Thank
much.
Good
Sorry,
you.
night.
before we
Thank
say our
you.
good nights, what of the attendance you said you will publish? We're still waiting for it.
Sure,
Public.
you guys will see it very soon. We are trying to combine everything together. So it will be sent to the group sooner or later.
Okay. Thank you so much.
You're welcome, ma. All right. Good night.